All right. Woo! Good evening, everybody. Well, thank you for joining us for the Understanding Medicare workshop. My name is Pastor Scott, and you're here because you want to learn more about Medicare in Hawaii. And so we have our very own Fay Walsh. She's going to be sharing tonight about just some of the tips and ways to prepare yourself. And even if you're at that age, to really get all the benefits that you can financially, and just tips and questions in general that she can answer tonight. So, but before we get started, I'm going to pray, and we're going to hand the spotlight to Fay. So, Father, thank you for tonight. Thank you that, Lord, that you just opened up this great opportunity to really download wisdom in navigating through this area of Medicare, finances, and even living in Hawaii, Lord. And I thank you that you've just given Fay the wisdom and the knowledge and the trust to navigate us through this area. So we thank you. We bless her, and just bless the tech tonight. Pray that everything goes awesome in Jesus' name. Amen.
And thank you.
Yep. All right, Fay, it's all yours.
Awesome. Well, good evening, everyone, and definitely want to thank you all for joining us this evening. Tonight, like Pastor Scott said, I'm going to be covering some key points of Medicare that could help you or a loved one even better understand this. It's a very complicated subject, right? And I want to start off by really just introducing myself and the agency that I work with. And for anyone that doesn't really know me or maybe doesn't know me well, again, my name is Fay Walsh. I'm a mom of one. And a little over 3 years ago, God blessed my daughter, I should say, with a baby girl. So I can actually call myself a kupuna, even if I can't really get the discounts yet anywhere that go with the title, right? But I have an extensive background in banking, actually. And I moved over to the insurance realm a couple of years ago. And I just fell in love with the Medicare aspect of insurance simply because I genuinely feel I make a difference in people's lives, specifically the people's lives that I work with, right? So this agency that I work with, it's called Insurance Options Hawaii. I have to say that I love working with this agency specifically because we all work as a team. We provide local service and support. We support each other as well. We're all licensed and Medicare certified, which basically means on top of being insurance licensed, and all the requirements with the insurance licensing, Medicare also requires additional training, additional testing and certifications. And that's really just to ensure that we understand the rules. They can be very complicated. And so they have to make sure that we understand what we're talking about before we go out and talk about it. And then lastly, we service all the islands with several agents that have extended their licenses into other states. And so for me, I'm also licensed in the state of Washington. And mostly that's because I have family out there and I visit the area often. The agency I work with, again, Insurance Options Hawaii, it's owned and operated locally. It has been since 2006. Our purpose here is it's solely to be a Medicare expert resource to people that, to the beneficiaries that need it. And so the advisors, we're mobile. We usually meet clients where they feel most comfortable. Sometimes it's in their home, but more often than not, it could be like a coffee shop or some other public place where they can just feel comfortable. And we can provide them with individualized attention to understand their needs, because there's a lot of questions to make sure that what they have and where they are is where they should be. So we try to give them that individualized attention. I do want to note down at the bottom is I'm not a financial advisor. I don't advise anyone on financial planning. I don't help anyone to balance their checkbooks or anything like that. And as a Medicare advisor, I'm actually unable to offer financial advice of any kind. I'm here really just to advise you on the Medicare side of things. Let's see, Medicare facts. Medicare, I think that this is really important to kind of give you some understanding about Medicare itself. Medicare is administered by a federal agency called Centers for Medicare and Medicaid Services that was established in 1965. but it's the Social Security Administration that handles the enrollment and eligibility for Medicare beneficiaries. And I added these two little facts here because I found them pretty astonishing. In the US alone, there are over 62 million Medicare beneficiaries in the Medicare system. And then adding to that, there's over 10,000 baby boomers that turn 65 every single day. Some may need Medicare and some may not, but they should all at least have the information to make an educated decision on that, which is why I'm here. The next slide, it goes over original Medicare and eligibility. So original Medicare is Part A and Part B. You may or may not have heard of these different parts of Medicare. This is kind of where we get into the meat and potatoes of things. Who's eligible, right? Not everyone who turns 65 is eligible for Medicare, despite what most people think. If you have certain disabilities or are age 65, that's only part of the eligibility. The other part is that you have to have worked and paid into the system for at least 10 years or 40 quarters. If that's kind of like if you didn't work 10 years straight, maybe you had a break here, or you stopped to raise your kids, or whatever the case is, 40 full quarters to have paid into this system. And you may also qualify if you didn't work, but maybe you had a spouse that did, or if you were married for 10 years, previously married for 10 years, you can receive benefits under a former spouse. If you meet all these qualifications, you qualify for Part A, which is the hospital insurance. The premium is usually free. And you also qualify for Part B, which is the medical portion, like the doctors and all of that stuff. And Part B usually has a premium that starts at $164.90 and that's for 2023. That changes every year. That amount will change every year. Last year it was up at like $170. 2023, they dropped it by like $5. So it's not always going to go up. There could be ups and downs. Let's see the next slide. Okay, so this is important. This is a quick look at Medicare, and there's really two main options that you have with Medicare. There's original Medicare and Medicare Advantage. So this is oh, sorry. If you're able to take a screenshot of this, this is really a good breakdown for the 4 parts of Medicare. Okay, within the Medicare system, there's Part A. I talked about that. That's the hospital. There's Part B, which is the medical, the doctor visits and everything like that. There's Part C, which is this Medicare Advantage part. And then there's this Part D, which is the prescription drugs. So if you only get Part A and B, then you're missing this whole drug section. So if your doctor prescribes a drug that costs on the market $150, you'll have to pay the $150 without this Part D, if you only have the original Medicare, which is A and B. So Part A goes over, it could be skilled nursing, it's hospital visits. If you get admitted to a hospital, it's home health care. There is a deductible on that. That's $1,484 this year. Part B, again, I talked about was the medical, the doctor's visits, the outpatient visits. If you have labs, x-rays, preventative services, it could be like mammograms or anything along those lines. Those are all part of Part B, and there's a deductible of $203 this year. The issue with original Medicare, again, Part A and Part B only, is that Medicare only pays 80%. Your portion or your co-insurance is 20%. So if you have to pay, if what they're billing you is $1,000, your portion is going to be $200 out of your pocket. And there's no maximum to that. Like if you go to the hospital and you end up having to pay $2,000 because it's a $10,000 bill, there's no maximum. If you have a $100,000 bill, you still end up paying $20,000. There's no maximum there. There are supplements that you can buy to help take care of that additional portion, But Part A and Part B, the original Medicare, if all you do is get original Medicare, it's not going to take care of that extra 20%. It also doesn't take care of that Part D, which is the far column. Again, the prescription drugs. If you have a hospital visit, more likely than not, you're going to have medication. And medication isn't cheap nowadays, right? Even the generic stuff isn't cheap. We all think it's affordable because there's these co-pays, right? If you have the coverage, your co-pays end up being like $5, $10. I mean, I think the most expensive prescription I've ever purchased was $50, and that was just my portion. But it can add up if you don't have coverage for that, right? So you have to get this Part D, and that costs money. But Part C is these Medicare Advantage plans. So what the government did was they said, we're going to hire these outside companies to manage some Medicare plans. We will pay them. So instead of us paying the 80%, that company will. So these are companies out there that offer Medicare Advantage, and they have plans that include Part A, Part B, and Part D. These are the ones that have preferred providers like the PPOs and HMOs. Some of them they have to be in network kind of things, whereas Part A and Part B usually don't have to have in network. Most doctors will accept Medicare, or you can get reimbursed by it. There are additional benefits that you can get in Medicare Advantage plans, but again, it's all dependent upon the beneficiary and what their needs are. There is at the bottom, it says MOOP, M-O-O-P. That's maximum out of pocket. There's a safety net there because with these Medicare Advantage plans, there is a maximum out of pocket that you will pay. Some of them could be $3,000, some of them could be $5,000. Each plan is going to be different, but it gives you a safety net to say, I will never pay more than this for my medical insurance every year. The next slide is a quick look at Medicare. And this, again, kind of goes over the two options that you have, which is the original Medicare, the A and B, or the Medicare Advantage, which is Part C. So the original Medicare, again, includes Part A and B. You'll need to add the Part D, and you can also add the supplements or Medigap policies. They basically help to pay for that additional 20% if that's all you have is the Medicare, original Medicare. The Medicare Advantage plans, these Part Cs, they include Part A and B and can include Part D. Some of them don't. Again, Part A is the hospital, Part B is the medical, Part D is the drug coverage. And some of the plans actually offer additional benefits like dental, vision. Some of them have naturopathic healing like chiropractic, massage. Some of them offer durable medical equipment like wheelchairs or oxygen, and they'll help to pay for all of those things as well. But again, I'm just going to kind of take this back. Everybody's going to be different. Some people should stay with original Medicare and just get the supplements, and some people should go to Medicare Advantage plans. It's not going to be a black and white for everybody. Now, there is help out there for individuals that have limited income. Different types of assistance for people could be this Medicare savings program where they help pay for premiums, like that $164.90 that I was talking about. They can help pay for that. And in some cases, they can help pay for the deductibles if there is a deductible, and even cost sharing amounts like if you have your co-pays, basically, right? There's a Part D low income subsidy, and they help to pay for prescription drug coverage. So if they're not going to cover the drug coverage portion of it and the premium for that, they actually help to cover some of the co-pays on the prescription drugs. There's also Medicaid. So these are different options. So for people that don't have the income or have very limited income, we do have options that we can help walk them through in getting the help that they need. But there are qualifications, financial qualifications that they have to meet in order to obtain this. This is just for those of you that already have Medicare, you should be familiar with these cards or this card. And I want to cover some key enrollment periods because everyone thinks that Medicare is only during a certain period of the year, usually at the end of the year. You see all these commercials that come out about Medicare Advantage plans and all these things. And I just want to cover that there's four key enrollment times that you may want to either enroll or change or update, whatever the case is. And the first is the initial enrollment period. So this is basically when you first turn 65, or it could be 2 years, it's not listed here, but it could be 2 years after you've started using Social Security disability income. You have to have been using it for a certain period of time before they can qualify you for the Medicare. But we usually recommend that you're gonna start looking at this about 3 months before your 65th birthday. You can look at it well before. In fact, we recommend you look at it well before, but you can enroll up to 3 months before. It doesn't start till the month of your 65th birthday, but you can enroll up to 3 months before. And you can enroll up to 3 months after. So the example that I use here is if your birthday is in June, right? You can March, April, and May. So those 3 months you can enroll and it would start in June. You can also enroll July, August, and September, and it would start on the first of the following month that you've enrolled. So if you enroll in September, it would start October 1st. But you have that window, and what that window does, it helps you to possibly avoid penalties. There are penalties involved with Social Security if you don't enroll correctly or timely or at all. There's penalties involved if and when you do end up getting Medicare. There's also the second one I have here is the annual enrollment election period. This is October 15th through December 7th every single year. Doesn't matter what day of the week these land on. This is the dates that they have these open enrollments every single year. So a lot of times, a lot of people were coming to me in the first week of December saying, I have to enroll, because they thought they needed to. And some people did, some people just wanted to change. What you can do here during this period is you can take your original, if you only have original Medicare, Part A and B, right? And maybe D, you can switch it to an Advantage plan, a Medicare Advantage, a Part C, or you can switch back. If you have a Part C, you can switch back to original Medicare if that's something that fits what your needs are. You can enroll in supplements if you need to, the Medicare supplements that they have, Medigap policies. The next time that you can enroll in anything is called general enrollment. And this is we're in this general enrollment period. This is January 1st through March 31st. And if you didn't enroll in Part B when it first became eligible for you, so for instance, if you turned 65 and you never enrolled in Part B, right? Your coverage will begin, you can enroll here and your coverage will begin the first of the month following. So if you enrolled this month, if you never had Part B and you enroll this month, you'll start the 1st of February. Okay, so you can still do that now. You can also, and then with this general enrollment period, there are penalties if you don't enroll when you're first qualified or you're first eligible. So once you turn 65 and you don't enroll within that 7-month period, the 3 months before, the month of, and the 3 months after, there are penalties that can add up for every single month that you haven't enrolled, and they're lifetime penalties. So that's one of the reasons why I'm trying to get this information out there, especially early on, because the penalties are for lifetime. They're not just like a one-time penalty. Lastly, there's this special enrollment period. There's actually more than 3 particular times that you can enroll I just put the three most popular, but these are things like if you move from another state, you have to find another carrier because it may not be the same carrier in your state. If you have a loss of employer coverage, so if you qualify and you're 65 or older, right? Or if you have the disabilities or whatever the case is, and you qualified, but you had coverage. So just the example I would give, if I was 68 years old and I just retired, right? I wouldn't have needed coverage before because I was working full time and my employer covered me, right? Now's the time for me to enroll, but it's not really my birthday. It's not, maybe it's July. It's not any of the other enrollment period times, right? I have this time frame, this specific time frame because I lost my coverage. They're giving me an opportunity to go ahead and enroll it. So I don't get penalized. I don't anything like that. You can, and there's an 8-month time frame from the time, like say you did retire. There's an 8-month period from the time that you retire that you can enroll using this special enrollment period as a reason for enrolling. Let's see. Enrollment in Part A's and A and B. So there, if you go ahead and start receiving Social Security benefits, in most cases, as long as you've met the eligibility requirements for Medicare, they'll automatically enroll you in Part A and Part B on your 65th, if you're receiving Social Security. So if you're working maybe a part-time job and they offer you benefits and you don't want to get the Medicare, you need to decide and let them know. That's key. Otherwise, they're going to enroll you and you're going to have to start paying for that. And it comes out of your Social Security more often than not, the $164.90. There's also, if you're not yet collecting, you could be 65 and not collecting Social Security. Maybe you have good retirement plan. And you know, maybe Daniel Peters helped you out really well and you have a great retirement plan. So you don't need to have enroll in this. You have, you know, you're paying for your own plan, whatever the case is, and you don't enroll and you don't want to enroll, you can do that. And it doesn't have to be automatic if you're not collecting Social Security yet. They won't do it automatically until you start collecting the Social Security benefits and that you're eligible. I would recommend that have these bullet points down at the bottom that you have other insurance that you, if you're going to bypass Medicare, make sure that your insurance is qualified, that you can delay it. Most insurances in Hawaii are fine, most of them. If you have some odd insurance that I would definitely check, but with like HMSAs, the Kaisers, the HMSAs, all of those, they're qualified plans. So if you still have those, then you're fine. You wouldn't really qualify for, you wouldn't have to worry about a penalty. You can choose to accept Part A since it's more often than not premium free. It doesn't cost you anything. But if you want to delay your Part B, you have to let Social Security know if you are going to be accepting the Social Security benefits, the monetary Social Security. Now, timing is everything. Okay, I mentioned the 3 months prior to your 65th birthday. If your Part B is not automatic, or if you no longer work or have credible coverage, super important. Timing is everything. If you decide to continue working after age 65, just make sure that your employer coverage is credible. Again, like I mentioned, the HMSAs, the Kaisers, the HMAs, the basic coverages here in the state, they should be fine. But if you have some, you know, coverage from the mainland or your employer has something that's not like the typical insurance in Hawaii, you should definitely check to see that it is credible to avoid those penalties. And when you decide to retire and you are over 65 years old, you want to start at least 3 months prior to obtain your Part B coverage to be effective the month that you do turn, that you either retire or turn 65, right? And that you lose employer coverage so that there's no gap in coverage for you. Oops, I'm sorry, moving ahead of myself. And then at the same time, you'd want to contact someone like me who can kind of explain and go over your particular situation with you and help you find what's best for you. There's a lot of options out there. So as an advisor, I come to you and I'm going to ask you specific questions about you and your situation. Everybody's situation is going to be different. So that's how I'm able to review your options with you. You may not be something that maybe your neighbor or your friend has may not fit what you need. So seeking an advisor like myself, it doesn't have to be me, but seeking an advisor like myself who's certified can really help you, guide you to where you should be and what would be best for you. And then if you don't choose Part B, which is the medical, or Part D, which is the drug coverage, when it's first eligible and then want it at a later time, you can be subject to penalties. Again, those penalties are really, they may not be a lot of money, but when you're on a fixed income and you're retired, they add up. Why would you want to pay extra that you don't have to, right? And then getting ready for Medicare. So there's marketing materials that come from everywhere, right? There's mail that comes at you. There's commercials all over the place. You've got phone calls that come from telemarketers. You've got advice from your friends and families and neighbors. And I can't stress enough that everyone is different. And one plan doesn't fit everybody, right? Everybody's needs are different. So it really does help to have an advisor who can ask the right questions and guide you in the right direction for you. And then I have a summary here, which is basically you want to contact Social Security at least 3 months prior to your 65th birthday. Contact an agent or an advisor like myself at the same time, so we can walk you through the process and make sure that you are being steered for you and what your individualized needs are, and what steps you need to take, where to call, or where to get your Social Security, all of that stuff. Let us know if you're retiring from a union or a company that offers retiree medical benefits, because there are a lot of companies and unions out there that have amazing benefits that it's really sad, but I've seen seniors be sold on plans that they've had to pay for and didn't need. I've helped an auntie that was paying over $300 a month for a plan that she didn't need and really wasn't even using. And so I'm here to be a sounding board and to help people figure out what they need, what they don't need, and where they should go, right? So sometimes if you're a retiree, your plan is good enough. You don't need to pay for anything else. So that's really important to tell your advisor. Family and friends, again, advice is wonderful, but keep in mind their situation may and probably is different than yours. And that I just want to remind everybody, you have options. There's a lot of options out there with Medicare. So one key note, when you're contacting Social Security, I always recommend to my clients, make sure you keep detailed notes and document when you contact them, who you spoke to, what they specifically said, and everything along that line. Just keep detailed notes. And these are, I don't know if you want to take a screenshot of this. This is just some basic information out there. You've got your Medicare, where you can go for information on that, Social Security. You can go to Medicare.gov and request a Medicare and You book. It's like this thick. So they require us as advisors to know what that book says. So that's why it's probably easier to talk to me, someone like me who can kind of guide you in that direction. My information there is there as well. And so at this point, I'm going to go ahead and open it up to question and answer. If anybody has questions, I'm going to stop share. Is that okay, Scott?
Yep,
Pastor Scott?
good. Yeah, great job. Awesome presentation.
I don't know if there were any, I'm not really keeping track of the chat, but if there were questions in the chat, or if anybody had questions and wants to go ahead and ask anything, I'm more than open to sharing.
Yes. Does anyone have any questions? So I took a screenshot of some of the slides and I posted them in the chat. So they have your number too. But does anyone have any questions regarding the presentation or even your situation?
Fay, go ahead. I see somebody raising their hand.
Oh,
Glenn,
oh there, yeah.
okay. I wanted to ask a general question. I know it's subject to change, but what is the general cost of Medicare Advantage on a monthly basis?
It is subject to change, and it does depend on your situation, but it's in 2023, the base amount is $164.90. And that you can either, there's options on how you want to pay that. It can come directly out of your Social Security, which is what it does for most people. So when they get their Social Security check, it's $164.90 less every month than what they should get, than what they're eligible for, because it pays directly to your Medicare. You do have the option to pay it directly though, or have a direct payment, automatic payment from your account. There's different options on how you can pay that. But
so did I hear you 164.90 right now? So it's the same as Medicare Part B. Okay. Now, so that means if I take Medicare Advantage, I need to pay 164 times 2?
No. It kind of takes the place of Part B because it includes it.
Thank you.
So it's $164.90 one time. It could cost more depending on the plan. Some plans have richer benefits, and so they charge you an additional premium to that. Some people want that. They don't want to have to pay anything, or maybe they, when they go to the doctor, they don't want to co-pay, or they want to make sure that, I know I'm going to have, maybe I have diabetes. So with diabetes, I know I need more supplies and I need my plan to be a little bit more rich in that area. So I may have to pay a premium, just depending on everybody's situation. It's different again.
Thank you.
Yeah, great question. Colette, I think you were going to ask a question, right?
Yes. Hi, Fay. Thanks. That was very informative. I've been watching all kinds of ads for so long trying to make sense. But so just clarifying, you said that 3 months before, 3 months after, we're to enroll or register. I don't know what the right word. But if I am still working and I have insurance through my employer, I still need to notify them, but let them know I'm not interested in enrolling, or because I think you said the original A is free, so why not?
Exactly. So people that are turning 65, I usually recommend that they enroll in you'd have to enroll in the Part A, because if you're not going to collect the Social Security benefits, the financial part of it, they're not going to enroll you automatically. So I always recommend just get it. Why not have the dual coverage on the hospital portion anyway, right? It doesn't cost anything, you may as well. But if you have coverage through your employer already, then you wouldn't need the Part B.
Got it.
Great. Yeah. If you're not collecting the Social Security yet, they're not gonna automatically enroll you. So you would have to do the enrollment for the Part A yourself.
Okay. Thank you. Very helpful.
Great questions. We have a question in the chat from Lauren. It says, if I have state DOE and have a good medical, is it true that there might be reimbursements?
Yes. So there are, again, everybody's plan is going to be different. There are certain unions, and I think the state union is one of them. I know that there's a lot of teachers out there that have this older plan. And what happens is it comes out of their Social Security. That's $164.90 comes out of their Social Security check, and then they get reimbursed by the union. So it just, everyone's situation is going to be different, but there are retiree plans from different unions and different employers that could either reimburse you or pay for it directly. It just kind of depends. Great question, but yeah.
Great question. All right. Anyone else have any more questions?
Faye, I have a question in regards to my mom, a senior. She just got the Quest integration. You ever heard of that?
Yes.
So I'm trying to wrap my mind around what does it really mean? Only that she's been getting reimbursement from Social Security because they are now going to be paying for all what she was paying for, taking out from her Social Security. Is that correct?
Yes. So Quest is one of the forms of financial help. So you have to qualify for that. And when you have that integration, it's almost like they have a portion of Medicaid and Medicare usually.
Okay.
And that's why they call it an integration. It's a dual plan integration. So they're probably reimbursing her because she qualified prior and she already paid for certain amounts. So they're probably reimbursing her for all of that. And she had qualified back when. So there is the opportunity to get reimbursements too. Yeah.
Oh, great.
Good
Yeah,
question.
because on her card now, she has a HMSA Quest integration card, but her benefit is A, B, and D. A, B, D. So she got
ABD. I was like,
yeah.
hey, BD, what is that?
ABD, ABD. They skipped the C.
ABD.
I don't know why.
Yeah. It's the A, the part A, the part B, and part D. So part C combines all three. The original Medicare is just part A and B, and then you add the D. So she has A, B, and D. Part C is just a combination of all three.
Okay. Oh, thank you for verifying that.
Yeah.
Awesome question. We got another question in the chat from Glenn. It says, in general, if you have co-insurance after you retire, you don't need Medicare Advantage? That's a question. I know the trend is that more Medicare beneficiaries are enrolling in Medicare Advantage plans. If you have no other plans, then is it most likely best to enroll in an Advantage plan?
That's a really good question. And I don't want to say it's most likely. Everyone's situation is going to be different. I know that have original Medicare, A and B, they purchased D, and they also have supplements. And based on their medical condition, that is really the best plan for them. They may not get the extra dental, they may not get the extra vision, they may not get all these extras, but based on their medical needs, and these are questions that I go over with people and individually, their medical needs, it's actually more affordable for them to pay that for the supplements because their co-pays and so I don't want to say it's more advantageous. It just depends on the person and what they have and what they don't have. So I just can't stress enough that it's important to meet with an advisor because the advisor is going to go over your individual situations. And even if you already are good with whatever you have, or your family member is good with whatever they have, if they've never met with an advisor, no harm in getting a second opinion, right? Or having somebody help you out and make sure that you're in the best plan for you. Have them take a look at what you have. So yeah.
Great question. And he added, and if your medical needs change from year to year, can plans only change during open enrollment?
Great question. No. So one of those special enrollment periods also could be a change in medical need. So for instance, if someone went into a rehab and they had to stay at a rehab right? Like maybe a month or whatever they're doing, or however long they have to stay, or they have to stay in a skilled nursing facility for a certain period of time. During that period of time, they have the opportunity to change if they wanted to. So there's different special periods that they can change in depending on their medical condition. There's a lot of them. I want to say there's like 20 or 30 different special enrollment periods that you could qualify for. So if you're looking to change, definitely want to speak to an advisor, because they can look to see, okay, are you doing this? Do you have that? Is this a reason? Are you losing coverage? Are you doing this? Are you, what's happening with you? And so that could be a reason. Your the medical condition could be a reason. Great question.
Great question. Thanks for sharing and thanks for asking those questions. Anyone else have any questions? Yeah, two more. Got a couple more. Yeah, there we go. Auntie Sandy.
Yeah, it's still not clear to me about the Part B. Oh,
Okay.
yeah, can you explain that again?
Sure. So Part B is so which part is not clear to you? What's covered or what
Well,
the amount?
yeah, and then why is there a penalty and when does that start and for how long? Because you're saying it's lifetime, but what does that mean exactly?
Yeah, so Part B, the coverage should start either, okay, so you have to have it either at age 65 or when you no longer have coverage after age 65. So if I was retired, if I didn't retire till I was 70, right? But I had credible coverage, I wouldn't need to pay for additional coverage. So I wouldn't need Part B, right? So that's fine. They're not going to penalize you if you had credible coverage. But if at age 65 or say at age 70, I retire and I say to myself, I'm very healthy. I don't need medical. I can take care of myself. I do naturopathic stuff. I'm good. And I don't enroll and I don't have any credible coverage. The time that you don't have credible coverage, so say I go 2 years without credible coverage, they count however many months you have, and there's a multiplier that they use. And there's a penalty based on that multiplier. So the number of months by a certain percentage, and that's how much you would pay. So what happens is that the payment increases your Part B premium. So instead of paying $164.90 this year, you may end up paying $175. It's not a lot. It's actually pretty small usually if we catch it in time. Like if we catch it within the first 2 to 3 years, it's not going to be a huge amount. But if you go 15 years without it, it could be pretty substantial. So you want to just at least get the knowledge as to when you should, when you shouldn't individually, especially if you're working or if you are planning on retiring or planning on not working and you are not going to have coverage and you're 65 or older, definitely want to speak to an advisor as to, what does this look like for me? If you don't have coverage, you definitely want to speak to an advisor as to like, okay, what is the percentage? Because everyone's is going to be different. So we can calculate that for you if there is a situation where you did not have credible coverage for. And sometimes, just as an add-on to that, if you did have credible coverage and you apply for Part B later on, Social Security may actually ask you to prove that you had that credible coverage. So you may have to go back to your employer. You may have to prove that you actually had the coverage for those, at age 75 years, that you had coverage for all that time. Otherwise, they can penalize you. Does that help a little bit, Auntie Sandy?
Yes, it does. Now, when it has to do with a spouse who is retired, say for me, I'm retired, but I'm covered under Uncle Glenn, who is still working And so he has Medicare, but he has HMSA also.
Okay,
So it would still be beneficial that I have the B, even though we have HMSA coverage.
Wrong,
necessarily.
coordination of benefits.
Yeah, if you have credible coverage through Uncle Glenn, it's not required. Again, I'm gonna recommend that you go ahead and enroll in the Part A, because again, it's free. It's almost like a dual coverage for your hospital stays.
Right.
There's no premium on that. But for the Part B, as long as you have that credible coverage, and it has drug coverage for you, you probably don't need to enroll in Part.
Okay. Thank you. Thank you, Fay.
Great job. We have, Daniel, you had a question? Yeah.
Hello, Fay. Thank you so much for this great information. You're an amazing communicator. I just had a quick question. Well, I think first off, I did want to make the comment that if you can just clarify that Medicare does not cover long-term care, because I hear that misconception a lot, and then there's a lot of confusion with different people that I talk to. So if you could just clarify that and what the difference is, right? But then also, I guess I meet a lot of different people that are in Kaiser Advantage, Medicare, Humana, ARP, and all that kind of stuff. So could you clarify the difference, or if there's any benefit to any one of those, or how does what you do, I guess, work with those people? Because normally what happens is people will retire and then they'll just call their health insurance company and then enroll in the Advantage plan for Kaiser or HMSA. But I guess from what you're sharing, I feel like there's a lot of value in talking to someone like you. Can you clarify how that works differently?
Absolutely. For your first question, it is definitely not long-term care. They don't pay for everything. They're not going to pay for you to have home care completely. It's definitely not long-term care. And that's definitely something that I highly recommend that people get. So that's where you would come into play, I believe, right? So if that's something that you're looking at and you think that, hey, if I go into a skilled nursing facility, that this is going to be completely covered, it's not. That's where you would definitely want to plan for and speak to someone like Daniel. The second question that you had regarding all the different plans, again, speaking to someone like me, it may not be the best plan for them. So in fact, I'm just going to share about a client I assisted recently, where she's had HMSA her whole life working, and she just kind of did exactly what you said. She transitioned into this HMSA Akamai Advantage plan. And when I met with her and I was able to, decipher, one of the two of the key questions that I ask are, what kind of medications are you taking and who are your doctors? And the reason that I do that is because each plan's doctors, they have their own networks, right? Each plan has their own medications that are covered and at different levels. So I take the time to research which plans have their doctors in network, which plans have the best results in terms of financially being able to afford their medications, right? Because of the co-pays or not. Those are two key aspects of what I'm looking to help people with, so that they aren't paying anything more than they have to, that they're getting the coverage that they need. If they needed dental, right? Some plans don't have dental at all. And what are seniors to do when they don't have a dental plan, right? Some plans don't have vision at all. Maybe they provide an exam once a year. But what do you do about your glasses? Glasses are very expensive, or contacts, extremely expensive. That's a couple $100s that you could pay additional, right? That's where I come into play and am able to say, okay, if dental is way more important than vision, then this plan has the highest dental, or this plan has the highest vision, or this plan has, you've got, with diabetes, this plan has the best plan for diabetes with this carrier. So there's different carriers and each carrier has different plans. And that's where speaking with someone like me can decipher and actually narrow them down and say, these are the best choices for you. And when you have these choices, this is what you want to look at. Is dental more important than vision? Is your medication more important than dental? Like, what's most important to you? So I can help narrow that down for people. There's a lot of choices. Thanks for the question, Daniel. Any other questions?
Yeah, does anyone have any other questions? This is so good. I love the Q&A too. This is so good.
Yeah, this is awesome. So if there are no other questions, I definitely want to pray for all of you before we close out. Is that okay?
Yeah, totally. Go for it.
Oh, Father God, I thank you so much for this opportunity to speak to everyone that's been here on the line and those that are going to be hearing it and watching it after the fact, if they couldn't join us. Lord, I ask that what was shared tonight just become wisdom, not just knowledge, but wisdom that can be acted upon with their individual situations of their loved ones, people that they know, and even themselves, Lord. I just ask that you protect them, that even with this knowledge, their plans may not need to be used as much as people would think that they would, Lord. That this knowledge is just knowledge that they can use to better themselves, Lord. I pray that for everyone on this line and their loved ones that they may be thinking of and that they may be working with or trying to help, Lord, that you have downloaded what they needed in their life, Lord. I ask for protection over every single person on this line and everyone watching in the future. I thank you for this opportunity to give back to my community. I thank you for the opportunity to speak to everyone that's on this line, as well as those that are going to be watching in the future, Lord. And I ask that the connection be made through you, Lord, only through you. I pray all these things and I pray for health and life and love. In your name, Jesus. Amen.
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 Thank you. That
Let's
was
give it a
awesome.
hand. That was fantastic.
Thanks for the questions. Those were awesome questions.
Yeah. Yeah, well, thank you so much. And like we posted in the chat, we'll be sending out a recording and posting it on our website. And this is not gonna be the last time we hear from you, Fay, because this is more than knowledge. Like you said, this is wisdom. And I think this is helping people, including myself and my family, really guide and prepare for these things, because it's an opportunity for anybody and everybody. So thank you so much. But let's give her one more round of applause. So good. Thank you so much. Other than that, mahalo and good night. God bless and take care.
Thank you.
Bye.
Thank
Thank you. God
you.
bless.
Everyone.
Good night. Thank you, Faye. That was
Thank you.
awesome.
Good night.
Great job.
Uh,